Hello, I'm Dr. Leonard Horowitz, the author of 17 books, 5 documentary films, and a half-dozen dental self-care packages, making me America's most prolific dental self-care expert and successful author. I'm also the co-developer of what I'm about to recommend here, Liquid Dentist. I'm here to tell you about the world's most advanced oral health and dental hygiene aid that is great for your general health and whole body immunity as well. I practiced dentistry and oral surgery as a family dentist and periodontist for 16 years, taught medical and dental microanatomy on the faculty of Tufts University, and joined the faculty at Harvard University School of Dental Medicine to lead a research team in investigating oral health and hygiene practices as they relate to a person's self-esteem and impact of stresses and strains on people's lives. Today, we have a crisis in American medicine and healthcare in general, as you probably know. And the damage is spilling over to dentistry as well, as medical costs have been skyrocketing, as you can see by the red line on this chart. Medical care costs have dramatically overwhelmed the general gross national product of America. That means our overall work output as a nation, depicted in the blue line on the middle of this chart, shows we are in big trouble. At the bottom in purple is the amount that people are spending every year on dental care. As you can see, that has not been rising, but in fact has been falling as people have less and less money to spend on professional dental services for treating dental decay and gum diseases, as companies have also been cutting back on dental insurance plans. Another factor that, in my opinion, is contributing positively to less money being spent on dental care is the fact that tooth decay and gum diseases are easily preventable diseases, much of which are being increasingly prevented by better public information. It is my hope that this video instruction will contribute to this increased savings, since, as you can see here, dental out-of-pocket expenses currently contribute to more than 1/4, 27% in fact, of the overall healthcare out-of-pocket costs. The overall average that each household is spending on out-of-pocket healthcare costs, including medicines and dental visits, was $3,231. The average for dental out-of-pocket costs was less than a third, but still $873. Dental out-of-pocket costs were more than the average amount that people paid for drugstore prescriptions. That was $700. And many people have credit card debt resulting from dental visits. The average amount of dental debt was over $1,000, and the median amount was $500. This knowledge comes from a scientific study entitled "The Cost of Dental Care and the Impact of Dental Insurance Coverage," published by the Access Project by authors Pryor, Protas, and others. On top of these direct financial costs, people who lose their teeth from needless tooth decay and gum diseases lose more than their smiles. Their self-esteem, self-image, and social activities are often devastated. This places a devastating burden on our productive nation. Can you imagine a movie star like Angelina Jolie smiling for the camera with a missing front tooth? Or similarly, a bank teller, police officer, or a school teacher? So the impact of oral diseases and lost teeth on society, overall productivity, and people's lives, self-esteem, and self-image can be dramatically damaging. My purpose in producing this video is to help you save your teeth and gums and cut your costs by more than half by introducing you to Liquid Dentist, a revolutionary new consumer health product perfect for this time in history, wherein people are awakening to disease prevention through better nutrition, improvements in hygiene, better water quality, and general self-care, and are motivated by urgent necessity, simply being unable to afford more costly professional care. In this Liquid Dentist infomercial, I'm going to teach you about saving your teeth and gums most easily, naturally, and cost-effectively, reversing tooth decay and periodontal diseases, and boosting natural immunity at the same time you do your simple self-care. In other words, I'm going to show you how to practice good oral hygiene, better food selection, and then encourage you to do what no other company or expert recommends with any other dental mouth rinse. That is, you swallow Liquid Dentist after swishing with it for 3 to 9 minutes a day to reverse tooth decay and gum diseases. And if you do what I'm recommending, it should save you most of what people spend for dental care every year. That is, for about $1 a day or $365 a year, you will save as much as $500 per year if you spend as much as the average American does on dental care. And unlike most dental professional services, Liquid Dentist is guaranteed to please you or your money back. So you have nothing to lose and a lot to gain by watching this video and trying Liquid Dentist for a month. Now let me start by sharing the little-known secrets about tooth decay and gum disease so you will understand how and why you should take control over your own dental destiny. If you want to end dental drilling, filling, and billing, here's how to do it. First, you must realize that tooth decay and gum diseases are caused mainly by germs that you allow to accumulate in your mouth, in plaque on your teeth, the worst of which grows between your teeth and beneath your gum lines. Now these germs need food. They need to eat, just like you. And they eat primarily refined sugars, carbohydrates, especially concentrated in sticky candies, sweetened cereals, and processed foods, and yes, even chocolates. So to starve the bugs, stay away from these bad kinds of sweets, refined carbohydrates, sugars, cakes, cookies, and even those chocolates. Unless, of course, the chocolate has a high concentration of cacao and is sweetened with sugar substitutes. You can use stevia as a sugar substitute, or use xylitol sparingly, or even better, use fresh squeezed cane juice if you can get it, and make food and drinks sweet with it. Also, barley malt is far less risky than white sugar in candy that feeds the germs destroying your teeth. Honey and maple syrup are not that great, but they're a lot better than white table sugar, or even brown sugar. Now every day, once a day, not twice or 3 times as dentists and toothpaste sellers recommend. Mechanically clean every side of every tooth using your toothbrush and floss or any other oral hygiene instrument you need to reach hard to clean areas. And above all, brush and floss thoroughly and correctly. Most people think they're doing a good job, but really they are not. And they end up disappointed by bad news from the dentist or dental pain. To be sure that you are cleaning your teeth thoroughly, heed my advice. Begin mechanically cleaning every time in the same way, at one side of one arch in your mouth, and proceed systematically, tooth by tooth and section by section in a most organized fashion. That way you can develop a habit not to skip any teeth in your mouth, as people often do without realizing it. You can use Liquid Dentist as a substitute for toothpaste, but that's not necessary because you are going to be swishing with it, as I'm going to recommend to you in a couple minutes. That is, after you floss. Using your floss, clean the sides of your teeth that brush bristles can't reach. Proceed systematically the same way every day, starting in one area and proceeding carefully to the next tooth, being careful again not to miss any side of any tooth. Be sure you are not sawing your teeth with the floss, but instead you want to plane the surfaces between your teeth. These surfaces are easily reached with floss using 4-finger positions that I will show you in a minute. The areas between your teeth that are hard to reach and clean are called interproximal surfaces. These are at greatest risk of decaying when left dirty. Now here are the 4-finger positions and how to create them. First, rip off 1 or 2 feet of dental floss and wind one end using 3 turns around your right index finger. Next, do the same with your other index finger, leaving about 6 inches of floss between your 2 index fingers. Next, as you pull the floss taut, this configuration provides you with 4 possible ways to floss the interproximal areas of your teeth. Those 4 finger positions include, number 1, 2 thumbs, then 2 middle fingers, then 1 thumb and 1 middle finger, and then the other thumb and the other middle finger. Stop the video here if you want to practice getting these 4 finger positions right. Then practice using these 4 flossing positions in your own mouth by creating a small, tooth-sized length of floss between your fingers to floss every side of every tooth in your mouth, as shown here. Once you learn this practice of proper flossing technique that most people who are manually dexterous can quickly master, flossing becomes easy and quick. Be sure you only use up and down motions with the floss, not back and forth motions or sawing motions. Do this proper cleaning by forming a C or C-collar shape around each side of each tooth with the floss positioned against each tooth. Then move the floss up and down the side of each tooth a few times, as though you were scraping the sides of the teeth that brush bristles can't reach or clean. Again, do not use back and forth motions, only up and down scraping movements. Scraping the whole side of each tooth to get the most plaque off is the correct way to do it. Next, for any large or deep cavities or periodontal pockets that brushes and floss can't access, use special instruments available through most drugstores. These include proxy brushes to clean out these hard-to-reach areas as best you can. Also use rubber tip instruments and toothpicks that can be used to massage neglected and inflamed areas. These are also called gum stimulators. For deep periodontal pockets, you can use an oral irrigator filled with warm salt water. Never use dissolved table salt because this is toxic to your nerves, believe it or not. Use a bit of sea salt instead. Just make sure you flush out the irrigator and equipment with fresh, pure water so that the salt isn't left in the instrument causing corrosion. In serious periodontal disease cases, you can also add the special Paul Keyes method of oral hygiene 3 to 4 times a week to reduce the depth of your periodontal pockets. Let me explain with some basic dental and periodontal anatomy. Normally, there's a tiny space between each tooth and the gum surrounding it, called the gingival sulcus in health, and a periodontal pocket when diseased. The worse your periodontal disease gets, the deeper and more inflamed your sick gums get. If this continues, the bone next to those pockets says, "Hey man, I can't stand this rotten, smelly, germy infection anymore. I'm leaving." And the bone then departs, leaving the teeth unsupported and loose. Ultimately, the teeth can fall out from this neglect. The Paul Keyes Special Periodontal Prescription is a time-tested and effective way to terminate a lot of periodontal disease fairly quickly and inexpensively. How do you do this? You make a toothpaste like slurry using a little bit of baking soda and hydrogen peroxide made fresh each time. Start with a half teaspoon and add a few drops of 3% hydrogen peroxide that you can purchase from any drugstore. Mix or stir the hydrogen peroxide into the baking soda powder in a spoon or in a dish or a clean countertop surface. Then, when it becomes a damp cream-like mix, carry it to your pocket with a finger, an oral instrument such as a toothpick, proxy brush, or rubber tip stimulator. Then try to push as much of this paste down below your gum line as you can. Try to push it down along the side of the infected tooth surface, down along the side of the infected tooth area, along the root surface. Then, once you get some paste down there, jet spray it down further using the oral irrigator. If you can't afford an expensive oral irrigator, don't worry about it. Use a cheap, blunt-ended syringe to flush your infected pockets with warm salt water and the Paul Keyes slurry. If you do this regularly, you and your dentist will be astonished by the improvement in your periodontal health. Now it's time to use Liquid Dentist to reverse tooth decay and even more periodontal disease. And here's how. Shake your bottle of Liquid Dentist and pour a capful of it into your bottle cap. That is about 1 teaspoonful. As mentioned, you can use Liquid Dentist as a substitute for toothpaste if you want, by wetting the bristles of your toothbrush and brushing normally. This then can be swallowed. In fact, it should be swallowed, unlike poisonous toothpaste containing fluoride and other toxic chemicals. And the added benefit of doing this is greater all-around natural immunity against the kinds of infectious diseases that we do not want. Next, after brushing, flossing, and cleaning, as I've mentioned, rinse your mouth thoroughly by swishing Liquid Dentist around your teeth vigorously for 3 to 9 minutes. You will enjoy the fresh, minty taste and actually look forward to doing this because your teeth will feel so good afterwards, incredibly smooth afterwards, so smooth that you will become addicted to that feeling of having ultra-clean, hygienist smooth teeth. And that too will cause you to take better care of your teeth and gums. Finally, gargle and swallow Liquid Dentist. Gargle comfortably to clean your throat as best you can. Then swallow to make the best use of this health-enhancing, revolutionary new product. Let me explain the benefits of swallowing Liquid Dentist instead of spitting it out. You may have heard that people's mouths are considered one of the dirtiest places on earth, with more than 1,000 strains of oral bacteria and viruses, many disease formers, inhabiting your average mouth. The dirty mouth doctrine, in fact, has earned its reputation. Knowing this, you can understand why I'm telling you to swish with and then swallow the Swish Liquid Dentist. Because by swishing, you are actually electrocuting and breaking apart the germs using oxysilver and other ingredients in Liquid Dentist. And by swallowing, you get a natural nutritional immunization against all of these germs without the need for any vaccination. So using Liquid Dentist in this way actually delivers a natural nutritional immunization against more than 1,000 strains of oral microbes. That's revolutionary. The silver oxygen oxysilver ingredient in Liquid Dentist kills and breaks apart germs that are in your mouth. And then when you swallow, these germs, the germ pieces, are all presented as antigens to your immune system that surrounds your gut. These immune tissues are called Peyer's patches, and they help prompt general immunity against germs that you swallow. This is how Liquid Dentist kills germs, naturally, using oxysilver and other natural germ killers, and swishing helps break those germs apart to be presented to your immune system in pieces. This stimulates general immunity most naturally and effectively for whole body protection and greater safety, since you do not need to take deadly antibiotics or risky vaccines ever again if you're using Liquid Dentist or oxysilver daily. Now test what you've just accomplished. Take the tip of your tongue and feel all around your teeth. Feel how clean and smooth your teeth have become. You should experience the cleanest, smoothest teeth you've ever felt in your life. Keep them that way by doing the same thing once a day. It's not necessary, as I've mentioned, to do this after every meal, as dentists commonly recommend, for people who use inferior oral hygiene products. And the best time to do this is before you go to sleep, especially for people who breathe through their mouths all night long while sleeping. The Liquid Dentist actually coats your teeth to prevent plaque from building up, and it prevents it from building up for up to 3 days after every use. Let me explain further how Liquid Dentist not only protects your teeth, but can actually reverse tooth decay from acid attacks by germs. Liquid Dentist has been designed to reverse tooth decay based on British studies. Tooth decay is caused by regular acid attacks produced by oral microbes that love sugar. The germs turn the sugar into acids that burn holes in your teeth. The hard calcium, phosphate, and other tooth-hardening minerals are actually dissolved from teeth as the acid attacks continue. The holes that form are called cavities, and dentists usually drill these out, and in doing so, extend the damage in order to replace the lost structure with filling materials, the most toxic of which is silver mercury amalgam fillings that have been increasingly replaced in recent years by safer and durable plastic and porcelain materials. But if you starve the germs, and thereby stop the acid attacks with good nutrition and good hygiene, as mentioned, and then kill the germs with Liquid Dentist containing oxysilver, then the dead germ bodies remain within the tooth, surrounded by the tooth's original protein fibers. These dead microbes and healthy filaments that dentists usually drill away can actually help repair your teeth naturally. According to the British studies, the natural protein filaments act like construction rebar in building foundations made of cement. Iron rods are used to strengthen cement buildings. Here, with Liquid Dentist decay reversal, the protein filaments act as a matrix around which the minerals, calcium, phosphorus, and others in Liquid Dentist actually deposit back into the teeth to help tooth remineralization and repair. Then, the germ bodies act like little stones that are usually placed in concrete or building cement in order to increase the strength of the filler material and the building. This is how Liquid Dentist reverses tooth decay, repairing small cavities and, potentially, if you do your job thoroughly, even, theoretically, large cavities as well. So Liquid Dentist flows minerals back into your teeth, including hard calcium and phosphate. And this 1-2 punch, germ killing and remineralization, creates new tooth structure even harder and more decay resistant than your original tooth structure. Again, this natural dental repair is done without drilling. So besides saving your teeth, you save the cost of needless trips to the dentist and all the pain commonly caused by dental diseases. So there you have it. Liquid Dentist, a most remarkable and innovative addition to oral health and hygiene, sure to please you, your hygienist, and even prevent expensive trips to your dentist. For more information on Liquid Dentist, visit liquiddentist.net or cureshop.com, CURESHOPPE.com. I'm Dr. Leonard Horowitz for Liquid Dentist. Thanks for viewing, learning, and sharing this wonderful information with others in need of saving money and their smiles. Bye for now.